Today we are going to talk about the top 10 dental mistakes that most people are making right now. And if you have any of these habits, please try to stop them immediately because they can cost you thousands of dollars in the future. So let's dive right into it. The first mistake is not flossing daily. A lot of patients come in and tell me that they do unfloss because it's uncomfortable or it shreds their gums. But this is a misconception. Flossing should not be painful. If it's painful, you're probably doing it wrong. The easiest way to floss is to cut off about 18 inches of floss. Wrap it around your fingers and hold it taut between your thumb and your forefinger. You want to leave a little bit of space between the contact of where your floss is touching your finger and the tooth. You want to go up and down against the tooth to make sure that you get the plaque and the bacteria from between the teeth. Make sure you go gently. You don't need to snap it or do anything like that. Just go nice and slow and make sure you go above the tooth and under the tooth. It shouldn't be painful at all. It might be a little bit awkward or strange at first, but if you do it for about a week, it'll become second nature and you won't even realize you're doing it. No, 2. This one is a big one, and it's only using your toothbrush to clean your teeth. This is a huge misconception. Your toothbrush is designed to clean the tooth surfaces, the front, the back, the inside, and your tongue. It's not designed to replace flossing. There's no way to get in between the teeth with a toothbrush. You absolutely need both flossing and a toothbrush to have optimal oral hygiene. If you're only using your toothbrush, you're leaving a huge portion of your mouth uncleaned. And you're probably getting cavities behind the teeth where the toothbrush cannot reach. Mistake no. 3 is not replacing your toothbrush frequently enough. A general rule of thumb is to replace your toothbrush every 3 months. That way you have a fresh, clean toothbrush every 3 months. The bristles will be nice and stiff so you can get a good cleaning. If you have a manual toothbrush, it might last a little bit longer. But even with an electric toothbrush, I recommend replacing it every 3 months. If you're sick with something viral, like a cold sore or the flu, you should probably replace your toothbrush even sooner. This is because the viruses can live on the bristles of your toothbrush and then reinfect you when you use it again. So if you get sick, you should replace your toothbrush as soon as you feel better. The fourth mistake is brushing too hard. When you walk into almost any dentist office, you will see posters and literature telling you to brush gently. There is no need to brush hard. The enamel of your teeth is the hardest substance in your body. The only thing harder than enamel is literally diamond. And your enamel is much thicker than the surface of a diamond, so you don't need to brush hard at all. The way you should think about brushing your teeth is like you read just barely touching the surface of the tooth. Use very, very light pressure and just touch the tooth very gently. You don't need to press hard or use lots of force. No. 5 is using the wrong kind of toothpaste. This one is very common. A lot of patients will pick out a toothpaste because of the flavor or the color. And while those are important, they're not nearly as important as the actual ingredients. The main ingredients in a toothpaste should be fluoride and some type of abrasive agent. Right. Fluoride is great for fighting cavities. Abrasive agents are great for cleaning the tooth and removing plaque and bacteria. Any other ingredients are usually unnecessary and sometimes can cause more harm than good. Some ingredients that are potentially harmful are sodium lauryl sulfate and saccharin. Sodium lauryl sulfate can cause irritation in your mouth and can cause your gums to bleed. Saccharin is an artificial sweetener that has been known to cause cancer in lab rats. Now, I'm not saying that using a toothpaste with these ingredients will definitely cause irritation or cancer, but why take the chance? There's plenty of toothpastes on the market without these ingredients, so why risk it?
Oh.
6 is another big one, and it's using mouthwash as a substitute for flossing and brushing your teeth. There's a couple problems with this. First of all, mouthwash does not clean your teeth. All it does is leave a fresh, minty taste in your mouth. It does nothing to remove plaque or bacteria. The second problem is that mouthwash can actually be harmful to your teeth. The alcohol in mouthwash can dry out your mouth. It can also reduce the amount of good bacteria in your mouth. This can lead to more cavities and gum disease. The only time I recommend using mouthwash is after you've brushed and flossed your teeth. As an extra step, if you're going to use mouthwash, use it only as a supplement to flossing and brushing your teeth. Do not use it as a substitute. Mistake number 7 is consuming too many carbohydrates. When you eat carbs, your body breaks them down into sugar. Sugar feeds the bacteria in your mouth, which produces acids that attack your teeth. This is the leading cause of cavities. There's absolutely nothing wrong with eating carbs, You just need to be aware that they will increase your risk of cavities. Make sure to brush and floss after eating carbs so that you can reduce your risk of getting cavities. Number 8. Not visiting your dentist regularly. Most people should visit their dentist every 6 months for a routine checkup and cleaning. At your cleaning, your teeth will be cleaned by a dental hygienist. They will remove the plaque and the tartar that you've been unable to remove with flossing and brushing at home. They will also check your gums to make sure there is no signs of gum disease. Your dentist will examine you to make sure there are no signs of cavities or any other diseases. Visiting your dentist regularly is the best way to keep your mouth healthy. It's also a great way to catch things early when they are easy to treat. No. 9 is another big one, and it is drinking your soda. Now, the reason this is bad is because when you drink your soda, it's hitting all of your teeth at once. This leads to more cavities than if you were to eat your soda. When you eat your soda, your saliva starts flowing. Saliva is very important in helping prevent cavities. Saliva helps neutralize the acids in your mouth, and it also contains minerals that help strengthen your teeth. If you chug down a soda, it hits all of your teeth at once. And because it was so fast, your saliva doesn't have time to kick in. This means that the acids in the soda can sit on your teeth longer, increasing your chances of getting cavities. If you're going to consume soda, make sure you eat it slowly, so that your saliva has a chance to flow. And finally, number 10, using hard bristle toothbrushes. Soft bristle toothbrushes are the best way to go. Hard bristle brushes are very abrasive and they can damage your enamel. They can also damage your gums, causing them to bleed. Always use a soft bristled toothbrush and be gentle with your teeth and gums. Those are the top 10 dental mistakes that most people make. If you enjoyed this video, make sure to subscribe so you don't miss my next one. And if you have any questions about your dental health, please comment below and I will do my best to answer each and every one of them.